Hello everyone, my name is Luis Filgueira. I'm an occupational therapy student. Occupational therapy is a profession that enables people of all ages to live life to its fullest by helping them to promote health and prevent or live better with injury, illness, or disability. OTs address mental, physical, developmental, and emotional elements that impact the client to perform day-to-day tasks. An important part of the OT practitioner role, based on observation and evaluation of the client's performance, is to make specific recommendations for most appropriate assistive technology to facilitate improved functional ability. Matching the client's abilities, preferences, environmental context, and barriers to technology device features is a distinct role that OT practitioners can fulfill, and which leads to productive outcomes for their clients. Why is it important to carefully research devices for clients and/or caregivers? Well, clients or caregivers want to purchase efficient and economical devices. The aim of purchasing research is to ensure optimal decisions and improve profitability. There are 5 important aspects to take into consideration to investigate. One of the most important is quality. The user must search for ideal items, but due to technological innovations, they can find devices that serve equally well or better and are more economical. Looking always for new products is key. Another aspect is quantity. It's important to keep the inventory levels low without affecting the service. Looking for devices that have the most in one device is more practical than having many devices with many functions. Another important aspect to take into consideration are the suppliers. Vendors who do not fail in supplying good quality material, who deliver on time, and whose prices are competitive might be retained on the approved list. Time is also important. The user must search and find out which is the best time of the year when prices are the lowest. The last aspect is price. If current suppliers are at the same price as other companies, the user can ask for negotiation. If the negotiation does not succeed, the user can take into consideration which supplier delivers the devices faster, facilitate payments, or accepts refunds in the case the device is not assisting the client's capacity to engage in occupational performance. Today I'm going to analyze 6 smart home technologies from the current marketplace. Their purpose, unique features, easy to use, durability, adaptation trends, pros and cons, and what I find interesting to make them part of a smart home. A smart home refers to a convenient home setup where appliances and devices can be automatically controlled remotely from anywhere with an internet connection using a mobile or other network device. Only a third of US households have a smart home. The most common devices used to have an ecosystem are Apple HomeKit, Amazon Alexa or Google Home Nest speaker. All of them do the same functions, however, Apple HomeKit is pricier. The first smart home device I want to discuss is the Google Home Mini. Google Home Mini is a smart speaker powered by Google Assistant. Google Home Assistant offers voice commands, voice searching, and voice-activated device control, letting the user complete many tasks after saying "OK Google" or "Hey Google, wake words." It is designed to give the client conversational interactions. Google Home Assistant is an economic device that can facilitate tremendously clients' ADLs. For example, the OT can educate clients on how to use the device to improve their quality of life. Clients with poor vision or with mobility impairments can benefit from this smart device using voice commands to ask any type of information related to leisure, and Google Assistant can play music for the client, and the client can also ask if will need an umbrella and what is the temperature today to save time in dressing or to decide what clothes we'll wear. In IADLs such as meal preparation, home management, to set the alarm to wake up at 6 in the morning, Google Home Assistant is perfect. It's also very good for rest and sleep, education, playing, social participation, and health management. The client can benefit from it to call the doctor as a reminder for the medication feeding, to turn on and off the lights, to get out of the bed, to go to bed, to play virtual games with other users around the country. Although Google devices are trying to show that they are excellent, they are still not there. Google Assistant is pretty amazing. However, the downside is that the internet is weak, and if the user wants to adjust the connection, it's a disaster. The robotic voice is not intuitive and cannot understand basic questions. The sensor is not good at recognizing voices and it reacts to anyone. The device without Wi-Fi is useless. I would suggest Google Home Assistant because it is easy for individuals with or without disabilities. It's flexible in use and connecting to other devices such as lights, TVs, or smartphones, and is very easy to use. It makes the navigation of the device very easy. The second smart home device I want to discuss is a smart TV. The smart TV is not affordable to everyone. However, it allows clients to participate in many occupations such as financial management, religious, spiritual expression, shopping, health management, rest and sleep, education, play, leisure, and social participation. The smart TV devices work with many devices such as smartphone, laptop, Google Home Assistant, Wii, PlayStation, and many other devices. Smart TVs are excellent for clients who are homebound, recovering from an injury in bed, with motor impairments or poor vision. It also facilitates the clients who live alone or in rural areas or have lack of access to trends in movies, music, documentaries, news, allowing them to be informed. The smart TV also brings the family together to watch their favorite shows or to entertain children while adults are busy with other responsibilities. The smart TV is more than an entertainment device. It can assist clients to cope with isolation or reduce anxiety. The smart TV is also useful to educate clients or patients in real time. They can ask the client if he or she are still watching TV. If they don't want to answer, it will turn off automatically. The smart TV can deliver messages on screen for healthcare team and also allow the clients to order meals on screen tailored to their diets. The smart TV has a great quality image and is friendly to the user. In cases individuals with poor vision, motor impairment, or health management difficulties, the OT can help clients to navigate and find relevant information to their needs with just a small remote. The OT can teach clients how to use through smart TV, ring video doorbells, alarms, and using it as a monitor to see, hear, or speak to visitors. Smart TVs are improving in quality, however, they are expensive and require Wi-Fi. In addition, clients with cognitive impairments or older populations might face challenges navigating smart TVs. I think having a smart TV is essential to gain quality of life. Clients can benefit from learning or watching documentaries or TV shows related to their own cultures. The downside of the smart TV is that it's pricey, needs Wi-Fi, and hackers can access to relevant information of the users. The third smart home device I want to discuss is the smart light bulbs. Increasing lighting in and around clients' home will increase safety and will prevent falls and injuries. Clients are occupational beings who are constantly bathing, showering, dressing, caring for others, or being assisted by health team, professionals, or caregivers. Motion-activated lights enhance security while providing adequate light in the dark to everyone. It is important to know that clients with visual or motor impairments cannot always find the nearest switch. Using smart light bulbs can prevent dangerous situations because they activate using the voice, or in case of speech impairment, they can get connected through a smartphone. Smart light bulbs are economic, however, they require the use of a device such as Google Home Assistant and Wi-Fi. They are not compatible with all smartphones. Some of them come with chargers, and if the charger is lost, the client will find them stuck in the dark. The variation in lighting is not adequate for individual needs. However, smart lights are automatic, and they are not wasting energy. Smart bulb lights are easily programmed. The OT can recommend the use of smart lights to clients who have suffered strokes or traumatic brain injuries or similar debilitating conditions to adapt to their new circumstances. There are various types of lighting in the room that the client can decide to control. The OT can assist clients with learning disabilities, motor impairments, or older adults to set up the smart light bulbs indoor and outdoor, on stairways, hallways, night lights in the bedroom, or to protect them and their families from hazards. Keeping lighting in good condition is one way to help prevent falls and injuries. I highly suggest smart light bulbs. They use low energy and have a long lifespan. Smart light bulbs increase security through motion or voice. The fourth smart home device I want to discuss is iRobot Roomba. This powerful smart device pulls in stubborn dirt guided by serious smart maps, enabled it to expertly clean and navigate in neat, efficient rows. If it runs low on battery, it recharges and resumes cleaning. This device is ideal for clients who live with pets. It is easy to navigate the manual or using a smartphone. It's also a programmable floor washer used by individuals with functional mobility or upper extremity impairments. The robot can be used on any type of floor such as hardwood, tile, and stone in kitchens, bathrooms, and terraces. iRobot Roomba can assist clients with home management. However, the smart device needs to improve to promote quality of life for everyone. The smart device has automatic navigation and is very noisy. The OT must investigate with clients with sensory disorder, defensiveness, balance problems, or poor vision if iRobot Roomba meets their needs. One option could be outside when the smart device is cleaning, but not everyone can be outside all the time. This device also cannot maneuver around all obstacles. It does not operate on different level floors and requires routine maintenance, putting individuals with poor balance, weak muscles, poor vision, or using a walker at risk of falling easily. The OT can educate individuals who need, want, or have smart vacuum robots with effective strategies such as removing hazards and obstacles, lighting up the living space, and prevent fall strategies to avoid tripping and slipping on the robot. I have the robot and I do not use it. It's very loud, doesn't clean well, and many times I have to look for it because it does not return to its station. The fifth smart home device I want to discuss is Rainfall Scale. It's a smart device that syncs with fitness apps. It works with Samsung Health, Apple Health, Google Fit, Fitbit, and Apple Watch app. It has 13 body composition analysis. It is using bioelectric impedance analysis to track weight, BMI, body fat percentage, body water, skeletal muscle, fat body weight, muscle mass, bone mass, protein, basal metabolism, visceral fat, subcutaneous fat, and body age. Considering body composition can give you an overview of the indicators, percentages, and allows to set easy waist and fat goals. The battery is rechargeable using USB with built-in lithium battery. It has options for unlimited users and a capacity of measurement up to 400 pounds. This smart device can be useful to keep track of the weight. The OT may need to evaluate clients with obesity who are interested in this smart scale. The OT intervention for managing obesity must focus on occupational goals. Some clients might not be interested in tracking weight. However, the smart scale can assist clients interested in health management and self-monitoring the weight. The OT can search with the client what is causing changes in weight, such as lack of physical activity or too much activity, stress, diet habits, medication. The smart scale is cheap and is very informative for those clients who are interested in very detailed analysis of their body composition. A client's weight is important information because it's often used to calculate the appropriate medication dose. The OT and the client can benefit from this smart scale to know the accurate weight of the client. An unknown client's weight, the dose of prescribed medication, could be significantly different from what is appropriate. The last smart home device I want to discuss is Philips Airsense. It's a smart air purifier that automatically boosts airflow, removing allergens from the air. 99.9% of the particles pass through the filters. It monitors, reacts, and purifies air using a multi-stage activate filtration systems of carbon filter for harmful odors and gases including pollen, dust mites, pet dander, and mold. Sometimes medication is not enough for individuals with chronic immune illness diseases such as asthma or eczema. Those clients can benefit from smart devices such as air purifiers that can help deliver clients or their children medication more effectively while reducing side effects. By having the right level of medication to the lungs at the right frequency the healthcare professional has prescribed, the client can live life with fewer symptoms and more freedom. Many healthcare facilities benefit from using air purifiers. Any area that is frequented by individuals with illnesses has a higher concentration of contaminants in the air. Smart purifiers decrease the spread of sickness and reduce airborne and surface pollutants, contaminants, and germs. There are clients with severe allergies to almost everything in the environment, and they can benefit from air purifiers. These smart devices can clean smoke, dust, and pollen, facilitating clients' life with breathing difficulties. The OT can assist the client to navigate throughout the app to check the client's indoor and outdoor air quality, while also assisting them with health management and providing education to program or to replace the purifier filters. The OT and the client can benefit from these smart purifiers during the sessions because they reduce the chances of airborne diseases, a factor very important to take into consideration with a vulnerable population such as clients with asthma, COPD, lung cancer, or cardiovascular disease. Although air purifiers are very effective against particle pollution without any harm for byproducts, they are expensive and need to replace the filters regularly to keep the unit in good shape. It creates costs and inconvenience to some clients. Smart home technology assists individuals with or without disabilities who prefer to stay in the comfort of their homes rather than move to a healthcare facility. However, smart home technology will be more helpful only if it is tailored to meet the individual needs of each client.